Next cell that we are going to move on to is your WBC. Who remember our WBC? Yes. White blood cell. What is the other name for white blood cell, Adrian? Leukocytes. So they are called leukocytes. So I already told you, what does the word cyte mean? Cell. So leuko means white. Erythro means red. Leuko means white.
What did that say? Glucose?
Leuko. L-E-U-C-O. Leuko. Leuko means white, so it means white blood cell. Erythrocyte means red blood cells.
So then what's the blood? Blood is just blood?
Blood is just blood.
Oh wow, no one knew that.
Now, so you have so many RBCs going around in your system. What do you think the ratio of a red blood cell to a white blood cell is? Yes, Adrian. 70. Almost close.
80.
90.
Almost close.
You forgot that
Adrian
one
was almost
zero.
close. He just missed 1 0. That's all. Okay.
That's not a lot. You missed.
For every 700 red blood cell, there is 1 white blood cell. Okay. So if I pull the picture up here, you see the amount of red blood cells in your blood. There's very few white blood cells. Okay, because you don't need that many white blood cells. You need more red blood cells to carry oxygen throughout your body. Okay, so for every 700 red blood cells, there is 1 white blood cell. Who remembers what's the function of the white blood cell?
I got a question. I got the answer.
Okay, what's the answer, Ben?
I got the answer.
Stop the bad guys.
Bad guys. Who are the bad guys? Viruses, bacteria. So these are the soldiers in our body. Ben, the board is here.
Yes,
Okay. So white blood cells are the soldiers in our body. They fight. They are the frontliners in the blood who is trying to fight bacteria, viruses that come into our body. Okay. So anything that's abnormal, that's foreign, they fight. Okay. Where do you think they live? Yes, Ben.
In the blood.
In your heart.
Wrong. Yes. Wrong. Yes, they live in your body. Otherwise, I wouldn't ask you.
In your heart.
In your heart. No. Wrong.
Your brain.
Yes.
Is it in your bone marrow?
No. It's in your tissues.
What is
In your
Look at that tissue.
in your tissues. Okay, so tissues like in your lung tissue, it lives in the smaller alveoli or the air sac of your lungs to catch all the germs that you're taking a deep breath in, breathing in, going all the way down to your lungs. It stays in tissues like those where it can catch the little virus and the bacteria. Yes, Rehan. I'm not telling you. Okay, so that is the second blood cell that we learned about. Okay, that is WBC. Nothing interesting to learn about WBC except that they are bigger, larger in size than your RBC. If you look here in this picture, they are larger and rounder. If you look, these are flatter. The RBCs are flat and they're easily sliding because there are so many of them, 280 million. But they are like little small golf balls. Okay?
We have peas in our blood.
Now there are different types of white blood cells. You don't need to know this. This is just for information. There will be a picture.
It's Zootopia in there.
Say again?
It's like Zootopia in there.
Zootopia.
More like
So
Bloodtopia.
So these are there are 5 different, so WBCs can be divided into 5 different types, okay? You don't have to write these down. They are basophils, eosinophils, neutrophils, monocytes, and one more. I forgot. Lymphocytes, okay? So there are 5 of them. So when you get sick, you get to a hospital, when they draw the blood, when we look at the blood, and when we see the numbers of these 5 particles of all we can tell you based on your white blood cell count, normal white blood cell count can be anywhere from 4,000 to 11,000. But once it's beyond 11,000, to find out exactly what is the cause for the white blood cell count to be more, we we look
That's
at
what I was
the
thinking,
different
right?
types of white blood cell under the microscope, under the slide, and they learn, oh, there is more eosinophil. So it could be an asthma attack that the person is having because it happens during allergy that the white blood cell can go up. And specifically, eosinophils increase during allergy. Neutrophils can be just from any virus, can be from any kind of bacteria. So studying individual white blood cells. So this white blood cell can be 5 different types that you have under the microscope that you can learn. Yes.
What is that purple Pokemon that's in our blood?
That's the next blood cell that we are gonna learn. Okay,
A Pokemon.
the next blood cell that we learned. What was the third one that we learned? Yes, Lorianne. Platelets. So platelets are the purple Pokemon. Okay, this
Don't
is
make
just,
fun of me.
that's how it looks under a microscope. Okay, platelets. Platelets help to form what? Who knows? Get a cut. Get a cut.
Oh, I know now.
Yes.
It helps to cover the cut like a scab, make it a scab. It's like, oh, light! That doesn't belong here. We need darkness. It's like the Batman of your
Answer is
blood.
blood. Let's keep it simple.
Is it regulation?
Thank you. Okay? You get a cut to form a blood clot. Okay? Simple answer. Let's not beat around the bush. Okay? Platelets help to form blood clots. So you get a big cut, could be a paper cut that you get right on your skin, or
It's
it
called
could be a cut from a knife. You fall down, you scrape your knee when you're riding your bike, okay? Or could be a big gunshot wound that you get. The clots are always formed by platelets,
They
okay?
form around it.
Say again?
They form around it.
They circulate in blood for how many days? Take a guess.
Oh wait.
No, I'm not asking you to guess.
1 week.
7 days, okay. Any other guess? 10 days.
I was
Answer.
so
Quick
close.
answer. So close. You were so close. So they circulate in your blood for about 10 days, okay? Now, before we move on to the next one, suppose you get an injury. How would you stop bleeding? What is the easy way to stop bleeding? Hold pressure. So suppose it is an injury that's causing lot of blood loss. You should try to keep it elevated. Keep your hand. Suppose if it is up there in the hand, try to keep it up over the level of your heart. Okay, your heart is here.
My
So
dad's a
try to
veterinarian,
keep it
so he
over the
touches.
side of your heart. Why? Because you're preventing the blood gushing out. Okay, keeping it up, elevated, prevents the pressure of the blood to be dropping down, and that can help. Holding pressure. Okay, how do you hold pressure? With your finger, with your hand? Or you just stand on that person? No. You can hold pressure with a cloth, anything that is clean, not dirty. Okay? Okay, you don't have to put anything in, you just cover it on top and you hold pressure. Okay? So pressure, good 10 minutes should be enough. Rehan. You should just stop with 10 minutes pressure, you should be able to stop the bleeding. Now, why I say 10 minutes? Because all these superficial wounds that you have, those are caused either from your capillaries, or what was the other blood vessel that we learned last week? There were 3 blood vessels that we learned. One start with a A, one start with a V, one start with a C.
What?
What were the 3 blood vessels we learned? Blood
I
travels
know.
through where? What is the red things called?
Okay, so veins, capillaries, and arteries.
Go, Ben. Good job. So what does
Finally.
arteries become? When arteries narrow down, what do they become?
Now that I don't know.
Great job.
That's
Yes. Arteries narrow down, they become smaller arterioles. Veins narrow down and they become venules. And the network of arterioles and venules together make a capillary. So when you have a superficial wound, you can hold pressure because it's from a vein or a capillary for less than 10 minutes. Suppose you have a big gunshot wound.
You died.
Of course, you die. Before dying, if it is not that superficial, it's not that deep. If it is to one of your major artery, answer is death. If it's not the major artery, if it's a vein, you can still hold pressure. But if it touches one of your main artery in the neck that we will learn in week 11 when we come back, or you're in a big car crash, okay, and you get stabbed or you get hurt right in the middle of the chest, that's directly into your heart, death is instant. Okay, you cannot hold pressure. No matter how much pressure you do, you will not be able, you will be exsanguinated, or you will completely be drained out of blood from your body. Okay, so quick revision, we learned all the 3 blood cells. Last week we learned about artery, veins and capillaries. Those are the narrow tubes that go throughout our body. And the 3 blood cells that we learned today was your red blood cells, also called erythrocytes, your white blood cells called as leukocytes, and your platelets that help you form clots. Okay, where do you think the blood cells are made in your body? We learned this in the 2nd chapter of anatomy when we started. We talked about this. Blood cells are made somewhere in your body. Nope.
Your bones.
Good job. You look back the answers, but you come out in this. Good.
What was that?
Good job. It's made in your bones. Remember, in the chapter of bones, they were inside the bones. I said there are 2 types of marrow inside the bones. Who remembers what are the 2 types of marrow?
Yes, we can do that.
Yellow and red bone marrow. Which marrow makes the cells? Ben.
Red?
Red bone marrow makes
Because
the
red
cells.
like
What does
blood?
the yellow bone marrow do? Store fat. It stores fat. So your red bone marrow, so you can write red bone marrow makes something called as stem cells. I'm sure parents have heard about it. Stem cells. So stem cells are very much used in doing research, studying if you have some diseases in the later part of your life. So when you are even a baby, when you are born, some parents choose to store these stem cells of the children in a bank, and eventually later in life they can do researches on those stem cells, help for a lot of cancer treatments. Yes?
I thought you only put money in the bank.
That's right. But there are other banks you put other stuff, okay?
In
There's
blood?
one bank that you put money in. There are other banks that you do health stuff in, okay? So red bone marrow makes stem cells, and from your stem cells you make your red blood cell, your white blood cell, and your platelets, okay? Last week I also told you how many liters of blood do you have in an adult body? Tyler, do you remember? No? Marcel remembers.
The amount of liters that you have in your body. Oh,
Anyone?
5 liters. 5 liters.
5 liters.
For an adult.
So adult human being has 5 liters of blood, and a child, infant, is nothing but a child who is up to 1 year of age, okay? They have about 1 liter in their body, okay?
So how much do we have?
We have 5. You have 5. You're not an infant. You're not totally an adult, but you still have 5 liters of blood circulating in your
So
body.
like 4.5?
Easy way to find out how much your blood you have in your body, you take your body weight and divide it by 13. You should get how much amount of blood you have. So 1/13 of your body is blood, okay?